All right, everybody, welcome back. Let's dive into something today, a little bit delicate. We're going to be talking about injuries during sex. It might seem kind of awkward, but trust me, this is important stuff to know. So we're looking at this medical document today, and it's called, get this, Injuries Sustained to the Penis During Intercourse May Cause Long-Term Damage.
Whoa.
Yeah, I know, right? Heavy stuff.
Yeah.
But the idea isn't to freak anyone out. We're all about giving you the facts so you can, stay safe and healthy. And one of the things that really jumped out from this document, at least for me, was, the possibility of a penile fracture. Like, who knew that was even a thing?
Well, it's actually a bit of a misnomer. When we hear fracture, we think broken bone, right? But the penis doesn't have bones.
Right, of course. So what are we talking about then when we say penile fracture?
Imagine like a really dry twig and you bend it too far. It snaps, right? That's kind of what happens here. It's a rupture of the tissue that surrounds the erectile tissue in the penis.
Ouch. Yeah, that sounds pretty intense.
It is. It's extremely painful.
The document mentions something about a popping or snapping sound.
Yeah, that's common. Along with immediate pain, swelling, bruising.
Definitely not something you'd want to ignore, I'd imagine.
Absolutely not. Ignoring it can lead to, long-term issues, even erectile dysfunction. Getting immediate medical attention is crucial.
Makes sense. So surgery is usually necessary in these cases.
Yeah, most of the time. This isn't something that'll just heal on its own, unfortunately.
Okay, so moving on from the more intense injuries, the document also talks about skin tears, which sound a bit less scary, but I'm guessing they're nothing to ignore either.
Right. I mean, anytime there's a break in the skin, you're increasing the risk of infection.
Good point. So what causes these tears? Is it just like too much friction?
Exactly. Often it boils down to not enough lubrication.
Right. Okay, so that's where communication with your partner is really key. Making sure everyone's comfortable, there's enough lube, all that.
Absolutely. Just saying, hey, we need more lube can literally prevent a world of hurt.
And it's not just about avoiding a little discomfort in the moment, right? Like, we're talking about potentially preventing some serious stuff down the line. Speaking of which, the document also mentions long-term conditions like Peyronie's disease. I'm not sure I'm familiar with that one. What is that exactly?
So with Peyronie's disease, you get this scar tissue, it's called plaque, that forms inside the penis. And it doesn't stretch like normal tissue, so it can cause the penis to curve or bend during an erection, which can be, pretty painful.
Yeah, I bet. And the document seemed to link this back to injuries, like past trauma could make Peyronie's disease more likely.
Yeah, exactly. It's not totally clear what causes it, but repeated injury, like say from a penile fracture, is definitely considered a risk factor.
So for anyone listening who's thinking, wait a minute, my penis isn't perfectly straight, do I have Peyronie's disease?
Well, first of all, some degree of curvature is totally normal. Don't panic. But if you notice a significant bend, especially one that's new, or if it's painful, or if it's causing problems during sex, then yeah, you should definitely see a doctor. There are treatments, medication, even surgery, depending on how severe it is.
Okay, good to know there are options. Now, switching gears a bit to another concern from the document, infections. We talked about how any break in the skin can up the risk of infection, but this section gets into more specifics.
Right, and it highlights how, sexual health isn't just about preventing pregnancy, right? There's a lot more to it. The document specifically mentions bacterial and fungal infections as possibilities after an injury during sex.
And the symptoms, are those pretty similar to, like, other kinds of infections?
Yeah, you'd be looking for things like redness, swelling, any unusual discharge, pain, discomfort, that kind of thing.
Okay.
But the important thing is figuring out the cause, bacteria or fungi, because that determines the treatment. Bacterial infections usually need antibiotics. Fungal infections need antifungals.
So no self-treating with whatever's in the medicine cabinet.
Exactly. Get a proper diagnosis from a doctor to make sure you're treating the right thing.
Right, of course. Makes sense. There's also mention of urethritis, which is inflammation of the urethra, the tube that carries urine. And it can be caused by a bunch of things, but the document seems to connect it to, what we're talking about.
Yeah, the document specifically mentions vigorous sex and dryness as potential triggers for urethritis. Basically anything that causes friction and irritation in that area.
Right. And the symptoms can be pretty uncomfortable, I imagine, like pain or burning during urination.
Yeah, you got it. Not fun. But the good news is it's usually treatable. If it's bacterial, antibiotics often do the trick.
Okay, so we've covered a lot of ground here, different types of injuries, long-term conditions, infections. It's a lot to digest. But the document doesn't leave us hanging, does it? There's a whole section on prevention.
There is, and it's really empowering because knowing the risks means we can make smarter choices.
Exactly. So let's dive into those prevention tips. What are some of the key takeaways?
Well, lubrication, like we talked about, is huge, but also just listening to your body, not trying to push through pain.
Yeah, that's easier said than done sometimes, though, right? In the heat of the moment.
It can be. But pain is our body's way of saying something's wrong. And ignoring it can lead to bigger problems later. So if something doesn't feel good, stop, adjust, slow down, whatever you need to do. Communication is key.
Communication is key. Okay, this next part might be a little delicate, but the document did mention that certain sexual positions can be riskier than others, particularly when it comes to penile fracture.
Right. And while it didn't say don't do this or don't do that, it did emphasize being cautious with positions that put a lot of pressure on the penis, like, for instance, woman on top positions where her weight is pushing down, or positions with a lot of forceful thrusting where there's a chance of hitting the pubic bone.
So again, it's about being aware, being careful.
Exactly. Understanding the potential risks and making choices that feel safe and comfortable for both partners. Talk to each other, figure out what works for you.
Yeah, it's like, I don't know, anything else in life where you're, using your body, like playing sports or something, right? You want to know what you're doing, what the risks are. So this has been, I gotta say, pretty eye-opening.
Yeah.
And okay, maybe a little cringy at times, but important, Like, we got to be able to talk about this stuff.
100%. I think that's the big takeaway here, right? Knowledge is power, and knowing this stuff can help us have, better sex lives, healthier, safer, more enjoyable, all of it. And hey, if anyone's listening and something we talked about today, rings a bell, or you're worried about something, talk to a doctor. That's what they're there for.
Totally. No shame in getting some advice from a professional. They can help you figure things out. So we've been really focused on the, physical side of intimacy. But this whole conversation got me thinking about, the emotional side too. Because just like we can get physically hurt during sex, I think we can get emotionally hurt too.
Right. So I guess as we wrap up here, it's worth thinking about how we can make sure intimacy is, safe on all levels, physically and emotionally, for everyone. Thanks for being here for this deep dive, everybody. Stay curious, stay informed, and until next time, take care of yourselves.